It's 2 a.m. You're half asleep when you hear it. Your dog, pacing by the door. Again, you drag yourself out of bed, open the door, watch them squat in the yard for what feels like the 4th time tonight, and you think maybe they drank too much water before bed, or they're getting older, or it's just a phase. You go back to sleep, and tomorrow you'll barely remember it happened. Here's the thing. Most owners see increased urination and assume the obvious. Old age, too much water, a weird day. And honestly, that makes sense. Dogs pee. It's what they do. But what if I told you that frequent urination is often the first and sometimes only visible sign that something is silently damaging your dog's kidneys? And by the time you notice anything else, it might already be too late for the simplest solutions. By the end of this video, I'll show you a simple way to track what's really going on, and the one mistake that makes kidney problems worse, not better. When your dog starts peeing more often, the brain goes to the obvious explanation. Maybe it's a urinary tract infection. Maybe they're drinking more because it's summer. Maybe they're just marking more territory because the neighbor got a new dog. And those explanations make sense because we've been trained to think urination problems are about the bladder, about behavior, about simple fixes. But here's what most owners don't realize. Increased urination isn't just a bladder issue. It can be the kidneys desperately trying to compensate for damage you can't see. Research published in Frontiers in Veterinary Science found that increased thirst and increased urination were the most frequently reported clinical signs in dogs with chronic kidney disease, appearing in nearly 15% of surveyed cases before any other symptom became obvious. More troubling, pet owners consistently ranked excessive urination as their most concerning symptom, but only after diagnosis, not before. The problem is timing. Your dog's kidneys have to lose approximately 2/3 of their function before standard blood tests even begin to show a problem. That means by the time your vet sees elevated numbers on a routine panel, the damage is already significant and often irreversible. So why does increased peeing happen at all? Because the kidneys are failing at their most basic job, concentrating urine. When healthy, kidneys filter waste efficiently and produce concentrated urine. When damaged, they need more and more water to flush the same amount of toxins. Your dog drinks more to compensate and pees more because the kidneys can't hold on to that water. What looks like a minor inconvenience is actually your dog's body working overtime to survive. Chronic kidney disease in dogs is what veterinarians call a silent condition. It doesn't announce itself with dramatic symptoms. It whispers. And by the time it speaks clearly, you've already lost ground. Here's how it works. The kidneys contain tiny filtering units called nephrons. In a healthy dog, these nephrons do their job quietly and efficiently. But as nephrons get damaged from age, infection, toxins, or genetic factors, the remaining nephrons have to work harder. They compensate. And for a while, they compensate well enough that nothing seems wrong. VCA Animal Hospitals explains it this way. The body actually increases blood flow to the kidneys when function starts declining, trying to maintain adequate filtration. This increased blood flow means more urine production, and because each remaining nephron is filtering a larger share of blood, the urine becomes less concentrated. That's why increased thirst and urination are often the earliest clinical signs of kidney failure, long before your dog loses their appetite or starts vomiting. According to IDEXX Laboratories, chronic kidney disease affects approximately 1 in 10 dogs over their lifetime, with prevalence increasing significantly as dogs age. For small dogs, early signs typically appear around 10 to 14 years of age. For large dogs, kidney failure can begin as early as 7 years old. And here's the part that catches most owners off guard. Dogs are biologically inclined to hide discomfort. In the wild, showing weakness means becoming a target. That instinct hasn't disappeared. Your dog won't tell you their kidneys hurt. They'll just keep drinking more water and asking to go outside more often, behaviors that look normal enough to ignore. I know this is difficult to hear. No one wants to think that something so routine could signal something serious. But the good news is, now you know. And knowing is the first step to catching it early enough to make a difference. The International Renal Interest Society, known as IRIS, has developed a staging system specifically because early intervention changes outcomes. Dogs diagnosed and treated at stage 1 or 2 have significantly better prognoses than those caught at stage 3 or 4, when symptoms become impossible to ignore. The question is, how do you catch it before it gets that far? There are real reasons this symptom slips under the radar, and none of them are your fault. First, gradual changes are invisible. If your dog started peeing 20% more overnight, you'd notice. But when it creeps up over months, the new normal just becomes normal. You adjust without realizing you're adjusting. Second, the obvious explanation is usually right, until it isn't. Most of the time, drinking more water on a hot day or after switching to dry food really is the cause. The problem is that kidney disease mimics these harmless patterns perfectly. There's no red flag that distinguishes normal variation from early organ failure. Third, routine blood tests aren't designed to catch this early. Traditional markers like creatinine don't become elevated until your dog has already lost 65 to 75% of their kidney function. That's not a screening tool. That's a late-stage alarm. A study from Oregon State University showed that a newer marker called SDMA can detect kidney decline when only 25 to 40% of function is lost, on average 9 to 17 months earlier than creatinine alone. But unless you specifically ask for this test, or your vet's standard panel includes it, you might miss that window entirely. And finally, veterinary appointments are short. Your vet has 15 minutes to cover vaccinations, weight, dental health, and whatever concern brought you in. Unless you mention the increased urination specifically, it's easy for everyone to assume everything's fine. So if you've been dismissing this symptom, you're not a bad owner. You're a normal owner operating with incomplete information. Now you have better information, and that changes everything. Here's what took me too long to understand, and what I wish every dog owner knew earlier. Frequent urination isn't the problem, it's the symptom. Treating the symptom without addressing the cause is like unplugging a smoke detector because the beeping is annoying and assuming that makes the fire go away. When your dog pees more often, their body is telling you something specific. The kidneys can no longer concentrate urine efficiently. They need more water to flush the same amount of waste. If you respond by restricting water, thinking that will reduce the accidents, you're actually accelerating the damage. Research from the University of São Paulo found that dogs with chronic kidney disease who received appropriate dietary management and hydration support survived almost 3 times longer than those who didn't, and took 2.5 times longer to develop uremic crises. Early detection isn't just nice to have. It's the difference between management and emergency. Dogs caught at IRIS stage 1 or 2 before the obvious symptoms appear can often be stabilized with dietary changes alone. Dogs caught at stage 3 or 4 need intensive intervention, often including daily fluid therapy, multiple medications, and careful monitoring. But you're here, watching this. That means you're already paying attention. And attention is what separates a manageable condition from a preventable tragedy. Remember what I said at the beginning about tracking what's really going on? Here's exactly how to do it. Step 1. Measure water intake for 1 week. Fill your dog's water bowl with a measured amount each morning. At the end of the day, measure what's left. Write it down. A healthy dog typically drinks about 1 ounce of water per pound of body weight per day. A 50-pound dog should drink around 50 ounces. If your dog is consistently drinking significantly more than that, especially without obvious reasons like heat or exercise, take that information to your vet. Step 2. Track urination frequency. How many times does your dog ask to go out? Are there nighttime interruptions that didn't used to happen? Are there accidents in a previously house-trained dog? These details matter. Write them down for a week before your vet appointment. Step 3. Request comprehensive kidney screening. Ask your vet specifically for SDMA testing alongside standard blood work and a complete urinalysis. IDEXX Laboratories research shows SDMA can detect kidney decline at 25% function loss, while creatinine waits until 75% is gone. That difference is measured in months to years of your dog's life. Step 4. Don't restrict water. This is the mistake that makes everything worse. If your dog is drinking more, there's a reason. Taking water away won't fix the underlying problem. It will stress the kidneys further. Step 5. Know the warning signs for immediate vet visits: vomiting, complete loss of appetite, extreme lethargy, ammonia-smelling breath, pale gums, or blood in urine. These mean the kidneys are in crisis. Don't wait for a routine appointment. Studies from Colorado State and the University of São Paulo confirm that dogs started on renal supportive diets early live significantly longer. Nutrition isn't a minor adjustment. It's a cornerstone of kidney disease management. You know your dog better than anyone. If something feels off, even if you can't explain why, trust that instinct. A simple test now can give you years you wouldn't have had otherwise. Next time your dog wakes you at 2 a.m., pacing by the door, needing to go out again. Next time you notice the water bowl emptying faster than usual. Next time you think, that's just old age, you're not going to shrug it off anymore, because now you know. Frequent urination isn't just inconvenient. It might be the earliest signal your dog's body can give you that something needs attention. Not panic, not fear. Attention. You don't have to be a veterinarian to protect your dog. You just have to notice what changes, ask the right questions, and act while there's still time to act. The best treatment for kidney disease is the one that starts before it becomes an emergency. And that treatment starts with you, watching, tracking, and trusting what you see. Your dog can't tell you where it hurts, but they can show you. You just needed to learn how to look. This is the mind behind the paws. Stay curious. Stay attentive, and if this video gave you something you didn't know before, subscribe and hit the notification bell, because next time we're covering 12 daily signs that could reveal kidney problems in your dog. Signs you might be seeing right now without realizing what they mean. What changes have you noticed in your dog's water intake or bathroom habits? Tell me in the comments. You might help another owner recognize what they've been missing.